Very good evening once again to you, Lagos. This is the Smooth Drive on your smoothest dial on Radio Smooth 98.1. It is 16 minutes past 5 p.m. on a Thursday evening, and 5:15 every Thursday is where we get to talk about your health issues, and what you need to know, what you can do, and basically how to live a fuller and better life. Smooth health on the drive. Welcome once again. My name is Ayokunmi, and it's going to be a very, very informative one this evening because we'll be talking about diphtheria. Yes, indeed, diphtheria. I'm sure if you've been, watching the news and listening to updates, you would have heard about the recent outbreak in Nigeria. It's a critical health concern, and the resurgence of this preventable disease is alarming. And we need to understand why it's happening, how it spreads, and most importantly, how to protect ourselves as well as our loved ones. So you can be a part of the show this evening. Any questions you might have for my guest, who I'll be introducing in a moment, any observations, really, you can share them with us this evening on the show. The WhatsApp number is 0809 444 0981. That is the WhatsApp number. We're learning about diphtheria this evening. So any questions, any queries you might have, please send them to us as we go along. All right. My guest I referred to earlier on is the one and the only Dr. Lilian Ochayi. She is a public health physician. She's going to help us unpack this particular situation. Good evening to you, Dr. Lilian. Great to have you on the show once again.
Thank you so much. Good evening, Aya.
All right, absolute pleasure. And oh, for you listening out there, I completely forgot to mention, apologies. You can also join us on YouTube. We're streaming at Smooth 981 FM Lagos. Smooth 981 FM Lagos. You can also drop your comments there if you have any questions whatsoever. All right, let's get into the nitty-gritty of the matter, Dr. Lilian. I mean, talking about diphtheria, we need to start at the beginning. Now, many people may have heard of diphtheria, but don't really know what it is. Can you, give us an overview and explain what it is and why it's such a serious issue?
Okay. Thank you for that. So diphtheria is a bacterial infection. It's highly contagious. And, why we are talking about it is because, there's been an outbreak recently, and we just need to know that, people should pay attention to diphtheria, right?
Mm.
So, like I said, it's highly contagious and it's caused by bacteria. And these bacteria, they produce toxins that can destroy healthy tissues. And they
Ah,
particularly target the throat, the nose, places like that, and even on the skin, you could have some symptoms like that. So when these bacteria causes these toxins to be released, they
mm,
can cause inflammation in the nose, in the throat, and cause disturbances in the respiratory tract. And they also cause something we call the pseudomembrane. It's like a coating that can be found in the tonsillar or the throat area when a person
okay.
opens their mouth. Yes. So this thing, it tends to accumulate in this area over time after the symptoms start to appear. So basically, it's a very serious disease, that infection that we need to pay attention to. So why we're saying it is important is because if it is not detected, if nothing is being done early enough, there's a high chance that it can escalate into something really life-threatening and, even lead to death, if a person doesn't pay close attention to it.
Huh.
Yeah.
That in itself is scary. I mean, generally speaking, when we talk about health issues like this, they tend to be scary with the way they present and the sort of effects that they have. And
Right.
I thank you for taking us into what it is and giving us a better understanding of what it is that we are dealing with here. Now, we've been hearing reports of diphtheria cases rising in different parts of Nigeria. It's not the first time. I mean, as well recently as 2022, I was going to say as
Right.
far back as that was just 3 years ago. It's not that far back, and now we're having another outbreak again. And in fact, this one even led to the death of a 12-year-old in King's College. Unfortunately,
Yes.
a sad one there. What do we know about this current outbreak, and where are the most affected areas? And really and truly, how bad is it?
Okay. Yes, so it's so in the past 3 years, the NCDC recorded 1,319 deaths, right? And recently we've had about 23 suspected cases with 20 Lagos, 3 Katsina, right? So
Okay.
we're having, and again, we might not also even have the exact numbers because some people may not present to hospitals and
There's that
in
as well.
things, yes, so we may not even have the exact numbers, but it's something that's, it's very much present and we need to do something about it. And because of how contagious it is, it can spread quickly, if something is not quickly done about it. So imagine the case you mentioned in King's College, the students that ended up losing his life to diphtheria, you know because the person was infected, he was
Mm,
able to infect others that were around because of how contagious this is. So, and because they were, there was this contact tracing that was done to identify people that had been around, at that period of time. It was easy to
right.
say, okay, let us put them here and watch them and, just give medications to ensure that it doesn't escalate. So yeah, presently we are, still dealing with the diphtheria cases and we're trying to reinforce surveillance because this is one way we can be able to detect these cases. And also it's also important that even as we health workers are paying attention to these symptoms when they come, the individuals out there also are aware of these symptoms. So when they start to notice something, they can come to the hospital as quickly as possible.
Okay.
Yeah.
Okay. All right. Thank you for sharing those stats for us in terms of uh the current outbreak. But of course, when you talk about it, diphtheria being passed from one person to another, it brings up the issue of how easily it spreads. That's one of the biggest concerns with any infectious disease. And with that being said, how does diphtheria spread from person to person? And what exactly makes it so very contagious? Is it like a common cold that anyone can pick up so easily from other people?
Okay, yes. Thank you for that. So it is it's more so usually when it starts, it can be said to, people would see it as just a regular maybe just an upper respiratory tract infection because it usually starts with general symptoms that are not so specific. Okay, but we would get
Right.
to that. But now just speaking about how it is spread, it's spread through respiratory droplets. So say an infected person coughs or sneezes and another individual is in that environment, they can inhale the bacteria in the air and also become infected. So that is one
Mm,
way that this diphtheria can be transmitted. Another way would be through direct contact with the individuals or close contact with their infected skin lesions. So diphtheria can also manifest on the skin in some
huh.
cases. Yes, so that's referred to as cutaneous diphtheria, but it's not as common as the ones that manifest within the respiratory tract. So that can also be another way that individuals can get diphtheria. Then the other way would be through touching, contaminated objects. They have this bacteria also has a resilience in the environment, and so it's possible for people to get this by touching objects that have been contaminated, by
Okay.
this bacteria. And so that those are the ways that individuals can get diphtheria.
It all sounds scary. I mean, the way that it can be contacted through droplets in the air, through contact with contaminated objects as well, poor
Right.
sanitation, man, it's just scary, and it just highlights how easy it is, to pass from one person to another. But
Yeah.
looking at that as well, that it can be passed from one person to another. Now we know that some diseases they hit certain groups harder than some others. Now, who is the most vulnerable when it comes to contacting diphtheria, and why exactly would that be?
Yeah. So the first would be because we know mainly that diphtheria is a vaccine preventable disease. So the people that will be most at risk are unvaccinated individuals, right? Or people that were inadequately vaccinated, particularly children. Because for children, we know that in their first years of life, there's an immunization schedule that they're supposed to go through, right? They're supposed to
True.
have this immunization according to the schedule. And diphtheria is also included in this vaccination schedule. So if, a child or a parent does not take the child to get vaccinated, or even if the child took some but did not complete the vaccinations, that could also be a risk factor that can make them more
Hmm.
vulnerable. Yes, so unvaccinated individuals are at risk. The next group will be children, I already mentioned. So younger
Yeah.
children, those under 5 are even more susceptible to getting diphtheria because of their developing immune systems. It's not as strong compared to adults, you understand? So the
Right.
the the chances of them getting infectious diseases are higher, and the severity is also usually more in children compared to adults also. Then another group of people that we would say are vulnerable are the elderly, again because of their lower
No,
immunity,
I mean, right, right, right.
right? So particularly some of them may not have also received this booster vaccination. So immunocompromised individuals, also people with conditions like HIV, or those that are undergoing chemotherapy, or just some other disease, diabetes, things like that that cause weakened immune systems. It can also put them at a risk of getting this. Then another would be people that stay in overcrowded environments or unsanitary areas. So, we mentioned
Hmm.
that if a person that is infected coughs, anybody in that environment has a chance of getting it, right? If you
Right,
are
right.
within, yes, if you are within that area. So, overcrowded environments should be avoided because anyone there can, contact this, yes,
And that's
easily.
difficult in so many areas within Nigeria. And looking at
Yeah,
here in Lagos as well, we know how there are a lot of areas within the state that are very densely populated. So
right.
there's a lot on our hands. All right. We'll take a very quick breather right here. And when we come back in, we'll be talking about the symptoms, what to look out for, because you know what they say, when you know better, you can do better. Keep it tuned. This is Smooth Health on the Drive. Smooth 98.1. Be back in a moment. Okay. We'll jump into a quick break, like 2 minutes, and we're
Okay.
back. So excuse me a moment.
Okay.
Enjoy a great creamy taste with Gano Cool Cool. Cool cow evaporated milk. Try it and taste the Gano difference.
This is Smooth Health on the Drive. This is Smooth Health on the Drive.
And we're back. Welcome back to Smooth Health on the Drive, the Smooth Drive that is on Smooth 98.1. This is your Love Music, Love Live station. It's 33 minutes past 5 p.m. on a Thursday evening. You are most welcome. We're talking about health issues. That's what we do every Thursday at 5:15. And today is no different at all. We've been talking about the recent outbreak of diphtheria in Nigeria and what you need to know to help yourself, help others as well, to keep yourself safe, keep yourself healthy. My guest is Dr. Lilian Ochayi. She is a public health physician. She's passionate about keeping us safe, keeping us healthy as well, and just putting the relevant information out there. That is why I got her on the show this evening. Welcome back in, Dr. Lilian.
Thank you so much. Good to be here.
Alrighty. And if you have any questions about this, because hey, if you've been listening to the news or you've been hearing about this, it's something that you cannot ignore. So if you have any questions whatsoever, this is that avenue for you to get those questions answered right from the horse's mouth, pun intended there. The WhatsApp number is 0809 444 0981, 0809 444 0981. That is the WhatsApp number. So send those messages in with any questions and queries that you might have. You can also do that on YouTube. We're streaming live at Smooth 981 FM Lagos. Smooth 981 FM Lagos. All right, let's get back into the conversation. Now, before we went on that break, I had mentioned that we need to know what to look out for because early detection can save lives. Dr. Lilian, what are the symptoms of diphtheria and how can people differentiate it from common respiratory infections like the flu? Because I had mentioned earlier that it's like when you describe what it mimics, it looks like a common cold basically at the beginning. So how can one tell the difference and what do we need to look out for?
Yes. Okay, thank you for that, Aya. So one of the distinct features or one of the distinct symptoms of diphtheria is the pseudomembrane that I mentioned earlier. It's like a coating. It's usually thick and grayish in color, which covers
Okay.
throat and the tonsillar areas. So usually if a person is um, 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 has been exposed to this infection, it usually takes about 2 to 5 days after the infection for the symptoms to start to manifest. So they could now start to notice low-grade fever, chills. They can start to have sore throats or notice that there's some hoarseness, in their voice. But again, some days later, then they start to notice whitish patches or whitish this membrane in the throat. And over
Okay.
time, it graduates to become thicker and then becomes gray. So the color also tells us how long, this thing has been on for and tells us the severity also. So this is the distinct symptom that can help us to say, okay, when we see this, we can be able to say, okay, this is a suspected diphtheria case. Some of them, because of these toxins that get into the body, the bloodstream and all, it can also cause neck swelling of the lymph nodes around that area.
Ouch.
Yes, and they could start to have what we call bull neck appearance. So it starts to get edematous and then starts to cause difficulty
What does
in
edematous mean?
it's like inflammation, like something is swelling.
Oh, okay.
Like it's
Edema.
swollen. Yes, edema, yes,
Ah, okay.
exactly. So basically, this would now, because if there's a swelling in the neck, it's where airways, air is supposed to go in and out. So then it makes it difficult for the individual to breathe, and even swallowing food also, there's difficulty swallowing. So these are the symptoms that we tend to notice with diphtheria cases. There can also be discharge from the nose. It may be bloody, depending on the cases, but these basically are the symptoms to look out for.
Okay.
Yeah.
Now that we know what exactly it is we should look out for, now that we have a good idea of those things that we should be very observant about. Now, if someone, let's say, suspects that they have the diphtheria, or someone suspects that someone else has diphtheria, I mean, what exactly should they do? What are the treatment options, and how effective are they?
Right. So if a person suspects, they should get to a hospital as soon as possible, because, like I mentioned, this bacteria releases toxins that get into the body, can get into the bloodstream and cause complications affecting the brain, kidneys, nerves, and things like that. So the first treatment that usually is given is the antitoxin, the diphtheria antitoxin. Okay, so they need to get to a hospital so that they can be administered this antitoxin, which will neutralize the toxin that has been produced by the bacteria that they've been infected with. Then the other course of treatment would be antibiotics, because yes, we did mention that it's a bacteria. So antibiotics would be the next line of treatment that will be given to the individuals. Then some other form of supportive care, depending on how severe the case has, become. If there's been, some people come in with airway obstruction, difficulties breathing, so they might need to be taken to the theater to have a tracheostomy done, where an opening is being made so that they can be able to breathe properly. So depending on the severity, then there will be supportive care that will also be given to help the patient feel better.
Okay. All that being said, those are some of the ways that it can be treated and all. Now, earlier on, we're going to backtrack a bit here. We talked about vaccines, and
Right.
clearly, diphtheria is a vaccine preventable disease. Yet we're seeing a resurgence. How is a resurgence? I beg your pardon. How important? How key is vaccination in preventing diphtheria, and why are we still dealing with outbreaks up until now if it's something that vaccines could have dealt with?
Yes, so vaccination is basically the most effective way to prevent diphtheria, because I mean, we know that it's infectious, and if you take this vaccine, it reduces your chances of being infected. And even if you do get infected, it will not be as severe, right? So they are they play a critical role in preventing diphtheria. But we're having these outbreaks and things like this because of challenges, with low vaccine coverage. There's inadequate immunization rates in different areas, and this can also lead to susceptibility within communities. So there are a lot of areas where we see that people are still not as vaccinated. Mothers don't take their children to the hospital to get the immunization according to the schedule, things like that. And this puts them at risk when they come in contact with this bacteria, right?
Okay.
Because it's supposed to be administered. For instance, in the immunization schedule, they're supposed to have diphtheria along with some other vaccines in the pentavalent vaccine at 6 weeks, 10 weeks, and 14 weeks. So if they miss this, of course, it reduces their chances of being protected against this. Another reason I feel would be vaccine hesitancy. You know, there's a lot of distrust in vaccines recently.
All the
Even not
anti-vaxxers and
just,
all that.
yes, and even not just recently, you know, over time too, there's been some misinformation and things like that that also would definitely contribute to the lower vaccination rate. So that's another reason
Okay.
basically why we are seeing more of these things happening now.
Okay. Now, knowing that vaccination is definitely one surefire way to at least ensure that this particular disease doesn't spread around like that. Now, how does an individual, a grown person, me, a man down the street, a woman out there, actually know if they've been vaccinated against the diphtheria? And if they're unsure, is there anything that they can actually do on that front?
Right. So basically, we if an individual is unsure, so basically they do tests, right? So but usually if a person doesn't have symptoms, you don't really need to do much, okay? If you then start to notice symptoms, then they would go ahead to do a throat swab and then take it to the lab. And then when there's, they've cultured something, of cultured the bacteria, which we know that causes diphtheria, then they would now be given the booster dose, basically. Okay.
Hmm.
So, and
Okay.
this, yes, and this booster dose, even presently they've been giving it to health workers in, at least in my facility. They've been giving to health workers because also we are also at risk because we are, seeing these patients when they
You're on the
come
front
in.
line, definitely.
Yes, exactly. So this is also something that, and so basically, if an individual is fine, they don't need to, okay. But if you then
Any final words on this particular matter for everyone who's listening out there?
Right. So I think what we're doing here is very important because it gives individuals the opportunity to be informed. So being aware of these symptoms and how it is transmitted is very important. So we already talked about what things to look out for, the fever, even though they may have symptoms like that look like the common cold, like Ayo said. We can also look out for this distinct symptom, which is that exudates, the grayish, thick exudates, pseudomembrane rather, that is usually in the throat area. And,
Okay.
just to practice proper hygiene, good hygiene, ensure you wash your hands properly so that you don't touch contaminated surfaces and also put yourself at risk of getting this. So and also to ensure that vaccinations, parents also take their children to be vaccinated up to date. It is also a way of protecting themselves and their families. So
Mm.
I think those are the key things to take from this.
All right, absolutely fantastic. It has been such an insightful and very educational discussion, Dr. Lilian Ochayi. And I will say once again, thank you for all that you do. You are one of those on the front lines, and we appreciate you for keeping us safe and doing the good work each and every single day.
Thank you, I thank you for having me. I had a good time.
As always, looking forward to our next discussion. Hey, you're never far from us right here on Smooth 98.1. I always look forward to having you on the show. Do have yourself a great Thursday evening.
You too, Ayo. Thank you.
All right. And thank you for being a part of Smooth Health this evening. Hope you've gotten a lot of information and valuable insights. We do this every Thursday at 5:15 p.m. Meanwhile, the Smooth Drive will continue. Ayokunmi definitely right here is going to be lining up great music for you to get you in a jiggy mood. It's a Thursday. We love to party. Keep it tuned.